All right, we are recording now. And so Josie and Rebecca, please go ahead and get started. We're so excited to be having you.
Thank you. Hi, everyone. Thanks for joining us today. I'm Josie Serrata, and I use pronouns she, her, hers. And I'm joined by my amazing colleague, Rebecca Rodriguez. Rebecca, you want to say hi?
Hi, everyone. She, her, and hers is fine for me, too.
So we're excited to be with you today. We're going to share with you some of the thinking that we've done around cultural specific evaluation and some practical worksheets and guides that we've developed as well. And so we really hope this is, and we know it's going to be a lot of information, but the purpose is for you to be familiar with our toolkit so that you can go to it on your own and use it as a reference and really dig into it. So our goal for today is to give you an introduction, and it may seem like a lot, but please know that we're going to go through it and hopefully take our time explaining all the different components. So, Rebecca, will you go to the next slide?
Yes, sorry.
No problem. There you go. So what we're hoping today, like I mentioned, is that you all will get familiar with our Building Evidence Toolkit. We'll give you some background on why we developed this toolkit, especially around a culturally specific lens. Really dig deep into understanding evidence-based practice through a community-centered lens and approach. And so we're hoping that at least you'll walk away with understanding how community-centered evidence works and how you can improve your evaluations by collecting community-centered evidence and knowledge. And then we'll end with some strategies that we've utilized in the past and suggestions for engaging stakeholders in evaluation planning, specifically engaging diverse stakeholders, and with some resources and worksheets for you to hopefully utilize in the future. Next slide, please. So we thought we would start with just letting you know a little bit about who we are. And so Rebecca and I are part of the national team, the national branch of Casa de Esperanza. So Casa de Esperanza is a local domestic violence organization in St. Paul, Minnesota. And serves the Latino community there in St. Paul. We've been around since '82, established really like many small community-based organizations that are culturally specific out of the needs from the community. The community needed some services that were responsive to Latino families, and we're seeing that the mainstream services weren't quite fitting what they needed. So our founding madrinas or mothers developed Casa de Esperanza. So Casa de Esperanza is a full-fledged domestic violence organization locally in St. Paul. It has a domestic violence shelter, but the central component of Casa de Esperanza is the community-based work. And so we have a very solid foundation in doing work from a community capacity perspective, really thinking and engaging community in everything that we do. So our services change quite often over time because of that. We do community listening sessions quite frequently, and then we'll change what we do on the community level. So we'll go from anywhere from offering, in the past we've offered little shops or areas where people could go and use computers to apply for jobs, because we were hearing that the community needed support around resources, to now we're using a full-fledged like promotora model approach, or community health worker approach, or peer-to-peer approach, where we develop leaders to become first responders, and it ranges from youth leaders across the age span. So we have, that's a pretty big crutch and heart of our work. And really all of our work up at the national level comes and stems from that community capacity perspective. We see that community has the solutions to and are the best fitted to end domestic violence and sexual assault. And so we really just try to work with them to develop tools to do that. and one of the tools we developed with some of our community partners was this evaluation toolkit, which we'll share with you today. Next slide, please. So as I mentioned, we are the national branch of Casa de Esperanza. So in the national branch, we have research and evaluation, Rebecca, myself, and a couple others. We have a policy initiative. Rosie Hidalgo leads that work and is here. We show this picture, it's not great quality, but she's here standing next to Obama when he signed the Violence Against Women Act, the reauthorization. And so we do quite a bit of policy work, research, training, and technical assistance across the U.S. And we're lucky in that some of our research work also helps to inform policy. And so we're a very applied research and evaluation branch and utilize community-centered approaches in everything that we do. Next slide, please. All right, so we're going to move on and dig into the Building Evidence Toolkit. And so I'll spend a little bit of time giving you the history. So at the bottom of the screen, you'll see our partners. So this was a community engaged approach in working with 5 community partners to really find out what it was that they thought would be helpful in answering this question around building evidence. So as we know, the trend has become that to be able to get funding, you have to show that your work works. You have to document evidence. It's gotten to the extent that some funders will only fund projects, curriculums that have a solid evidence base. And what they mean by that usually are curriculums that have been developed in academic institutions that have rigorous research methodologies behind them. And then and the expectation is that these things are kind of just rolled out into communities and specifically with marginalized communities. And there might be a mismatch between the development of that curriculum or program to what is happening on the ground and the expertise of practitioners and community members, right? And so we were in about 5-6 years ago, as we started this journey and just having conversations with our partners and thinking through, so how could we help community-based organizations respond to this push for documenting evidence, for being able to show that their program works, when traditionally domestic violence and sexual assault organizations have not had funding or been giving funding to do this type of work. So then all of a sudden there's this, this expectation and questioning of why we don't have our evidence base when we just haven't been funded to do it, right? Is one piece. The other piece we learned and we talk about here is that, you know, organizations that we work with are documenting their work. It's just translating it for the funders to understand it in a way that a funder can understand that the community-centered evidence is also valid evidence to show. So we started this journey with our partners. What they told us was, you know, we just need some tools to help with that translation. We need some tools to help us talk to our funders, to document our work and tell our story and the impact of the work that we do. It's not that we don't know how to do this, right? Every organization writes grant reports, or every organization collects some sort of data, intake data that comes in with their participants or community members that they're working with. Most organizations have had to tell their story and what they're doing, right? So it's not that they don't know how to do that. It's just that there's a gap between what the funders understand and what we see as a mainstream model being adapted by many funders around evidence-based practice that is being put on our community-based organizations and the cultural-specific organizations specifically. So we went on a journey and we developed this toolkit. Over a year process, we developed this toolkit, the different tools that were in it. We met in person a couple of times, and we really, this was a really participatory approach to this project. So what we have is our partners told us, there might be some newer organizations that are newer to evaluation, right? And so we think it's important to have a section for those folks. There might be some organizations that are already collecting data and are pretty solid in evaluation, but what they said, what they see often, and what was true for themselves is we didn't know how to tell a cultural specific story. So we knew how to talk about the services, that the deviant sexual assault services, the impact that was having. But when funders ask, like, how is your work culturally specific, which we still get that question quite a bit, why is it important to fund culturally specific programming? Isn't it just services for all, right? The same kind of thing. They really were having a difficult time articulating that and responding. And so we developed enhancing your current evidence section that is all about the cultural specific aspects of work and how you can enhance your evaluations to include those pieces. And then another section, and which part we'll go through today, is around exploring community evidence, and this is a conceptual model around evidence-based practice that we're really hoping that you'll walk away with a solid foundation today. That can be found in the Exploring Community Evidence section. And then the Learning Community, where you can go in and download resources. There's links to lots of great information that would be helpful. And so we're hoping that you guys, again, will be an introduction, and then you guys can go in there and play around after the webinar today. Next slide, please. All right, so our crux of our toolkit is the receta, or recipe. So our way of really breaking down understanding program evaluation. With our partners, we came up with this metaphor, really thinking of your program as a recipe. What is it that goes into a recipe, right? So being able to document your different ingredientes or your ingredients. What do you know? How do you know? What resources do you use? And then, if you have and you're working on your program evaluation culture in your organization, the hope is that your community participants are your tasters, right? That you're constantly in a feedback loop with them, where you're testing things out, you're asking their feedback, and you're improving and documenting what you're doing as you go along in this evaluation process. So evaluation, we see, is really the crux of it is to document your receta, right? Improve what you're doing and document your work in a way that others can hear it. And the hope is that in this webinar today, you'll really think about who may not be being considered in your evaluation right now. So who are those taste testers that you're leaving out? Are you mostly hearing from maybe one subpopulation of your community members or your participants? Are you maybe leaving out the African Americans that receive services from you or reach out to your programs, right? Are you leaving out folks from the different intersections? Is their perspective really embedded in your evaluation process as well? So we would challenge you today to start thinking about that element of your work. Who might be being left off currently? Who are those taste testers that you're not hearing from and getting feedback from? Okay, next slide. All right, Rebecca, I think you're up to start talking about evidence.
Sure, I can take this. When we were starting to talk about evidence, what exactly do we mean? So maybe you've heard, as Josie was explaining, the need to be evidence-based or use evidence and evidence-based practice. But for us, we wanted to take a second and think about what exactly constitutes evidence and evidence-based practices. So just, if you could, just think about these questions for a minute, and if you'd like to share your response in the chat box. Okay, thank you, Diana, for sharing. So a way to prove your work. And yeah, right, we always have to provide that what we're doing is having an impact. We have to prove often to our funders what we're doing is working, validating that the work we do matters. Yes, absolutely, thank you. So I want you to think about what constitutes best evidence, right? So when you hear about evidence in regards to program evaluation, many times people are referring to the knowledge that's produced to identify which program practices or activities create the change we want to see among our clients or survivors. So that seems like a pretty noble cause, right, to want us to use the best evidence so we can effectively serve our communities. So the issue then becomes apparent when we start to consider whose evidence counts. So who's producing the evidence, who's saying this is evidence and it needs to adhere to these things. You have to do RCTs, you have to have this academic, it has to be based on academic research. And oftentimes academic research doesn't have much input from community members. There is community-based academic research that has been conducted as well, but most of the time it's really kind of, it hasn't involved community members as much as we would like to see. And as Josie mentioned, you know, we really believe in community engagement and facilitating community capacity. And then another thing is when we consider whose evidence it is that counts or has been kind of presented to us in the form of evidence-based practice, when it results from the academic literature, we know that that literature has historically underrepresented communities of color, and it's often far behind what is happening on the ground in our everyday work. So I see a lot of innovation and a lot of really cool practices that are happening at community-based organizations on the ground and that haven't made it to the academic literature base. So we wanted to make sure that we're capturing kind of, or broadening the criteria of what we see as evidence. So in response to the limitations that I mentioned and some of the ones that Josie mentioned, and in collaboration with researchers and advocates and practitioners, we developed an approach to gathering evidence that broadened the criteria of what constitutes best evidence in our model. So we encourage its use as a way to help organizations document a variety of types of evidence for their work. And we're going to talk about that here. All right. So we're going to talk about expanding the understanding of evidence-based practice. So we have the community-centered evidence-based practice approach, which can be found in the evaluation toolkit. So I just wanted to walk you through the different components that represent in this, that are represented, and then just to give you some examples of how this might be used for your own evaluation. And I provided beforehand a handout on this. I hope you can follow along if you have that handy. So this is the community-centered evidence-based practice approach. This has also been published in academic research. It was published in January 2017, and we'd be happy to provide that article and the citation so you can use this when you're talking about your own evaluation. So I'm going to break these down by the different components, but really what this image is showing is the three circles, right, which represent different kinds of evidence. So earlier, when I mentioned how evidence was largely limited to academic research, such as randomized control trials and similar types of studies, so those types of evidence still have a place here under the documented evidence, so under this green circle. But we've also realized that traditional academic research is often difficult to access for practitioners. It's very expensive. If you ever try to download a journal article online and they want, you know, $30 to read that article, if you don't have a subscription or you're not affiliated with the university. So in addition to what I mentioned, that it's pretty limited in their representation of communities of color. So we wanted to make sure to include other sources of documented evidence that many domestic violence organizations may already have. So in addition to, you know, academic research, you might have things like case notes, intake forms, older program evaluation reports, those reports that many of you provide to grant funders on a regular basis. So these all have a place within our documented evidence in this expanded model of evidence. So we see those as valid sources of information, and that can help build the evidence around your program or services. So another form of evidence that's often missing from traditional understandings of evidence-based practice is community practitioner expertise. So practitioners who work directly with survivors may have years and years of experience to share on what they see as working or not working for the community that they're serving. So then you might want to capture the richness of their knowledge and experiences. And you can do this in a couple different ways. Josie had mentioned listening sessions that we hold with the community. So listening sessions or a focus group can help to understand, to document, to learn about the key elements of the work that they're doing on an everyday basis. So this helps add to our current understanding of the practices that we use with survivors. So those things that I was mentioning that might be happening on the ground that are very innovative, but yet haven't made it to the evidence base or the traditional understanding of evidence base. And then another thing too, you might want to consider if your organization has policies or procedures in place or any kind of mechanism for practitioners to reflect on their own practices, how they're improving on what they're doing. Often overlooked in evaluation is documenting and understanding how programs are being adapted as they're going through the life cycle of a program. So having that bit of information, right, so capturing this maybe from practitioners, how they're adapting their approaches, is going to be really helpful when you try to understand the program outcomes or the program impacts, to really understand, well, what exactly did we do? Did we follow this curriculum to a T? Or, you know, what modifications did we make, and how did they maybe improve outcomes or not?
Can I give an example here, Rebecca? I was just talking to someone yesterday, and they were describing to me what they do, and you know, on the ground, right? And both Rebecca and I are youth practitioners, and so we have that I think hat that helps us be able to bridge practice and research in a way that a lot of research really don't have, right? So that's why tools like this are really helpful. So they were giving me the example of working, so they have just two different curriculums that they've learned, and the way they divide it is very gender specific. And so they have a curriculum that they use for young Latino men and Latino boys. They have a curriculum that they use for young Latino girls. And it's very, you know, heterosexual focused, but that's how they have their curriculum currently. And the practitioner is trained in both curriculums. And so the practitioner was in one of the settings noticing that the traditional male curriculum was not working with the males that she was working with. So she started to pull tools that she knew was for the other curriculum, right? And so like she piecemealed curriculums together because she needed to respond in the moment to the youth that were in her group. And I think it was a primary prevention program, and they were, you know, focusing on, you know, knowledge and healthy masculinity, and that just like wasn't flowing with this particular group of youth that she was working with. And so she started piecing together, oh, well, let me like literally pull out these other exercises in the moment to see if they work, right? And that is like an amazing knowledge base. Like the fact that she did that, right? And like the owners or the developers of the traditional, very traditional curriculum, that's a knowledge piece right there. that they need to sit down, right, and take her experience of that practitioner in the moment who knew to piece things together in a different way, to respond, to engage youth, to really be able to think through these issues in a different way. Maybe it isn't not gender specific, right? So that's I think a key lessons learned that practitioners often, and those of you who are practitioners, in the moment you do things to respond to the folks that you're working with, to really support them. And so that's important, because oftentimes curriculums don't allow that, traditional EDP-based curriculums don't allow that flexibility, or don't have room for you to be able to document that. And what we're saying is that we encourage your program, your organization, to have a process where you're actually like debriefing with the practitioner and you're documenting and tracking how you need to improve what you're doing. But that was a great example that just came up yesterday that I'd share.
Yeah, that's great, Josie. Thank you so much. So the last little circle here, the orange one, represents community members' expertise. So this is in a different color. It's bolded, just to highlight our value for the lived experiences of the community members that we serve. So earlier, Josie mentioned listening sessions. I talked about it a little bit with regards to getting feedback from, your practitioners. So there are different ways that we can capture this kind of evidence. So for example, we may want to conduct those periodic listening sessions with our community stakeholders. Maybe we want to understand any new issues that they're dealing with and understand if there are some gaps in the services. Are there things that they're needing? So if you think of like a traditional maybe needs assessment, right, that would be one way to solicit community members' expertise. And in another way too, often what we do is when we are developing an evaluation tool or survey, we ask participants to review the tool, to provide feedback, to ensure that the survey is capturing what's being measured, what's being talked about in the program, to make sure it's easy to understand. So soliciting their feedback also helps them to feel engaged and more likely to participate in an evaluation later on. So as another example of maybe incorporating community members' expertise, many organizations are already doing this. So when you might collect testimonials from participants or success stories about what it felt like to go through your program, or those kinds of small snippets of kind of qualitative storytelling information. So this is also a critical piece of the evidence-based, so providing evidence for your program. And then lastly, just to note that we do see that there is overlap, right, between the different kinds of evidence. And then also that the three kinds of evidence, they're not meant to stand alone. So documented evidence, community member, practitioner expertise they don't exist in a vacuum, right? So we have to consider the evidence within its larger environmental and organizational context. And I'll talk a little bit about what I mean. So when we think about the environmental context, in considering what's going on today in the social political environment, these things can have an impact on what services we're offering participants or decisions that we have to make for our programs. So for example, for those of you that work with immigrant communities, we might have to adapt our approaches in this current political climate. For example, by creating safety plans around immigration, and not just about safety plans for violence, right, but to kind of broaden that to reflect the current environment. So you would want to document these adaptations and incorporate them into your evaluation systems. And then the organizational context. So things like funding sources, funding constraints, your staff, turnover, these types of things will influence what kind of work you have funding for, and what kinds of evaluations can be realistically accomplished. So considering whether your organization has a dedicated staff person to oversee evaluation activities, or are your case managers and counselors collecting evaluation data in addition to providing services. So this is going to be, an evaluation is going to look different, right, based on the resources that you have. And then another consideration is whether you have funding to provide compensation to clients who you might be asking to fill out a 10-page survey, right? So you're going to have a lot more success if you have a $20 gift card somewhere rather than, if you didn't have compensation. So I like to just bring these organizational kinds of things up because it's helpful when you're thinking about funding, right? And you're thinking about budgets and how much you need for an evaluation and the different kinds of things that you would want to account for. Maybe a part-time evaluation person, maybe asking for money for participant compensation. So just those things, right, will also influence our ability to build the evidence base. And as Josie had mentioned, we've been typically very under-resourced for evaluation with all, most of the funding going to direct services. But it's also an important resource to continue to fight for. Okay, so that brings us back to the model, the whole model back together here. The community-centered evidence-based practice model. We have the citation and article that we can send out. So I just hope that wherever you are in the evaluation cycle, that maybe you can consider how you may already have some of these forms of evidence in your organization and your documents, and then consider where you might want to enhance your evaluation to capture additional sources of information. So, for example, if you're not engaging a certain population, as Josie had mentioned earlier, that would fall under kind of community members' expertise, and then thinking about if you could fill that gap, right, in your evidence base. So, of course, while considering what an evaluation looks like within your current scope of work, your funding, identifying, I think, the organizational structures that are needed to support a robust evaluation would also be helpful for kind of incorporating these different kinds of evidence into a larger, more robust evaluation plan. So I know that was a lot of information, so I'm just wondering if there was any comments or questions that came up in the chat, or questions that I could answer, Josie or I.
We can give a moment to see if anyone wants to write any questions.
Yeah, just give a moment for folks to write something into the group chat if they have any questions, but there aren't any so far.
Thank you. Did you have anything else to add while we're just holding on, Josie?
Yeah, one thing I would add to just to put the EBP model in context, which I've heard is helpful. So most of you have seen that model, the evidence-based practice approach. So when funders are talking about evidence-based practice, right now they use it as EBP equals academic rigor, right? EBP equals a curriculum that has gone through a particular set of research studies. And actually, EBP means the decision-making process of including all of these forms of evidence. And so that paper that we are going to send to you all describes that. So oftentimes, funders are only looking at one bubble, but you can say, actually, our evidence-based practice is this. You can cite, our article. You can show how we pull evidence from, our evaluations. And then we also did, our practitioners use journals to reflect how their groups are going. And so we pulled that information as well. And then we had listening sessions with community members, and that's how we decided to adapt this curriculum, or that's how we decided to develop this program, right? And so then you're able to speak to that, you know, the work that you're doing is evidence-based, because you're not just willy-nilly, you know, making decisions. You're making evidence-informed decisions on an everyday basis. And so the problem is that funders don't quite understand evidence-based practice. And so you can hopefully use this tool to explain that to them and to validate what you're doing. The second part of it is that this approach comes from the medical model. So the traditional medical model is who developed EBP, evidence-based practice. And it was developed for medical doctors to guide them to use academic evidence, because what they were seeing was that they were making decisions kind of willy-nilly and weren't going back to the research to read what had come out of research. And so some medical doctors created this model to remind their colleagues to look at different forms of evidence when they're making decisions. Fast forward 30 years, and here we are, it's being rolled out to our field. And it wasn't developed for our field. And so this is a great example of something that needs to be adapted in its language and adapted in its context to fit the work that we do. And so you'll see that in the article, it's all about domestic violence and sexual assault programming. And so the language of it should fit and feel more familiar to you all.
Thank you, Josie.
Thank you. And I think what we can do is probably just keep an eye out for questions if you all want to move forward.
Yeah, absolutely. Okay. So I'm going to hand it back over to Josie, who's going to talk a little bit about some of these strategies for engaging diverse stakeholders in evaluation planning.
Awesome. Thanks, Rebecca. So again, as we mentioned, we really want you all to think about your evaluation planning and your plans, and who might not be currently at the table, right? So like I mentioned an example, like for us at Casa de Esperanza, we had lots of programming to support Latina female identified. We didn't have programming for men. And in one of our listening sessions, the community members were like, what are y'all doing? Like, if we're going to change violence and gender-based violence, we need to bring in the community members and the men into the conversations as well. And they need to have healing spaces and safe spaces as well to heal from their own trauma, to talk through their own experiences of discrimination and oppression, right? To be able to change the norms that they've internalized and that they're potentially acting out. And so we realized that was for Casa Esperanza, that was a community, a sub-community of the Latino community that was not currently being reached out to, included in prevention programming, included in intervention programming. So since then, they now have, and it's been a couple years now since that listening session took place, and they guided the community members, really took ownership. Once we asked, what is it that you need, and invited men to the table to talk about that, then they took ownership and said, just provide us a space. And we'll have these discussions, and we'll work with our youth in our communities, and we'll, work with you in partnership to change these norms and make things better, right, around gender-based violence. So, so that was a stakeholder that we weren't listening to. And then now that we did, we've had a big shift in the programming at the local organization in Casa de Esperanza with their work with men. So that's just an example, right? So thinking of who are you hearing in your evaluation? Do you notice that, particular groups that speak a certain language aren't responding to your surveys or aren't coming to your listening sessions? Are there language access issues, right? So thinking of who are those diverse stakeholders that have some stake in your program evaluation but might not be currently in the program. Who cares about your program? What do they bring to the table? Who's being underrepresented? What voices are missing? So taking a minute to kind of think for yourself and your organization, who might that be? Feel free to put it in the chat box if you have some ideas. but I'm gonna leave a moment for that, just to kind of self-reflect. You don't have to share with the group, but thinking of your organization, who's currently missing in your evaluation? Okay, so then once you kind of identified who might be missing, let's go to the next slide. And thinking through, how might they be involved? At what stage of the evaluation cycle may you reach out to them? Like Rebecca mentioned, we do a lot of reaching out to folks at the very beginning. So when we're developing just most importantly, the conceptualization of the impact that we're having, we can come up with our own examples of what that might be. Oftentimes we're missing something, right? So oftentimes, and Rebecca uses the example, I hope you don't mind me take your example, around Comunidad Latino. We were working with Comunidad Latino in Atlanta, Georgia, to develop their evaluation. And they have programming for the entire family. They have a better intervention programs, they have a support services for women, and they have a huge youth program that serves all children from 0 to 24. We were developing an evaluation that would ask those questions of the impact of the program for all of those groups, and then link them so we could see like how the family was doing. Well, in the original development of it, we left out asking the men about their parenting practices and how the program was supporting them in changing their parenting behaviors. So that was we wanted to realize that we left that out until we asked them, what is missing from the survey? How were these questions? Did you understand them? And they said pretty loudly, like, you didn't ask me about my kids. And you didn't ask me about how I might be changing. And because part of their group work was working around their children and their behavior and healing that relationship with their children and their partners, right? So that was a bit of stakeholder information we would have completely left out of the evaluation if we hadn't included them in the evaluation cycle pretty early on and from the beginning in the development of the tools, and then also with the program itself and the development of the logic models, right? The conceptual models that you use to guide the evaluation tools that you develop. Another key piece is really thinking of how accessibility. If you really genuinely want to embed your stakeholders in your evaluation strategies, what are the accessibility things that you need to think through, right? Around language access, around this time of day that you're working with them. If you have funding to pay for them to give you some time, that would be the preferred, right? If you're asking for community members to come in and, hey, we're developing this evaluation tool, we really want your feedback, then what kind of resources can you provide to them? Knowing that, maybe education, transportation, childcare, right? All of those things are considerations for community members when you're asking them to use your time. So what kind of resources can you invest in this approach, in engaging community stakeholders? What do you need to do to engage those stakeholders that are not currently at the table? So we talk a lot about organizational leadership, and who does the organizational leaders represent? The community members. And if you notice that some community members aren't coming to your door, it might not be that that they feel welcome at your door because they may not feel seen, right? So what do you as an organization need to do in your organizational leadership and staffing and organizational policies to change some things, right? So that diverse stakeholders feel welcome and are willing to give you their feedback, honest feedback on how your program is going. Rebecca, do you have other comments here? that you'd like to add? I think you're muted.
Sorry. Yes, I was just saying that there's great points that you made there, Josie. I think it's really important that we respect the time of participants when we're asking them to do things kind of above and beyond just their everyday services at the program. So thank you.
All right, so let's move on. And in the toolkit, there are worksheets to help you kind of think through engaging diverse stakeholders. Excuse me.
Sorry, if I can just go back to your last point. Somebody wrote in the chat box, and if you all have something to reply back to this. One of the things I've heard is, well, there are not a lot of POC or a lot of people with disabilities in our community or a lot of trans or queer, so why should I devote my programs to address these communities? If the sample is too small, why would I evaluate or involve these communities? So I'm assuming that, like, how would you reply back to that might be the question that this person's asking, or what are the challenges around this and how to navigate this?
Yeah, so so how to respond back to that. I think this next session, when we start going into principles-based evaluation and what we recommend for cultural specific organizations or organizations that want to capture cultural specific work. Our work is values driven, right? At the end of the day, we have certain values that are leading our work in ending domestic violence, sexual assault, right? Gender-based violence in our field. And so my answer to that would be, as a values-driven organization, right, going back to the root of what our purpose is in this field, you cannot continue to marginalize and oppress certain communities if you're really value-driven, if you're really an organization that upholds working with survivors and supporting survivors. That means all survivors, regardless if there's two, at your door at that moment. What are you doing to best serve and center your work for those at the margins? If you're an organization, which I strongly believe most of our organizations are in it for a certain value, for a human rights perspective, from a social justice perspective. And for me, I know that that's where you can maybe make some wiggle room, is when you talk from that perspective and holding organizations accountable to what they say that they're doing and the values that uphold their work. And I'm not sure, Rebecca, if you or someone else has other comments, but that's how I'd approach it.
Yeah, no, I think that's a really great point, Josie, how you framed it, right, and just kind of switching it a little bit. But also, if this comment is coming from like a sample size issue, I think that it would be easy to change your evaluation methods to fit the sample size, right? It's not always about getting 100 people to fill out a survey. Sometimes it's about singling out one person's story, right, in a case study, in a testimonial, to show that the impact of the program on her, or to identify the gaps of things that maybe that person needed in your program that weren't there to address her particular intersectional identities. And that can provide very valuable evaluation information for the program. I don't think it necessarily has to be about the size of the program. But I was just, that's the only other thing that I would add in terms of thinking through like evaluation methods and design. Yeah.
Awesome, thank you both so much. And the individual said, thanks, totally agree with you, but this is what I've heard within some programs, so thank you.
Definitely, yeah, and it's definitely, especially and we hear it often, and that's where partnering maybe and reaching out maybe to like the resource center and the cultural specific resource centers. We do a lot of TA work with mainstream organizations that might have like a smaller program embedded within their larger organization, and we help that practitioner and work with them to navigate these tricky territories. And so that's also an option, just to get partnered with folks that are like-minded and can support you in navigating change within your organization.
Thank you.
All right.
Yeah,
So thanks for that question. Oh, go ahead.
Yeah.
Does someone want to say something?
Oh, no, I was going to say thank you as well. You beat me to it.
Yeah, please ask other questions as we go along. So enhancing your current evidence, we're going to transition into the specific section of the toolkit. Remember I mentioned at the beginning of the webinar that we had this section based on the feedback and our partners saying that they really wanted to develop some tools for organizations who hadn't had the opportunity to speak to the cultural aspects, cultural specific aspects of their work. And how do they tell that story? And so we decided to use principle-based evaluation, which, I don't know if I had the book right here, but there's a recent publication of a great resource that I would recommend, and it might be in my bag. I work from home, so sometimes my stuff gets scattered everywhere. Oh, I see it over there. But I'll grab it in a minute and show you guys. We have the citation here, and it's a valid and legit evaluation approach. So principles-focused evaluation are what we have found is a great fit for the work that we do. Like I mentioned, as values-driven organizations, what we're most interested in is like what matters to people. Are we creating spaces where folks feel safe to heal, to share, right? To go on a journey with us where they are changing pretty significant things, right? Or they're healing from pretty significant trauma. Are we providing those spaces for folks in a way that's culturally responsive, right? I would add that piece. And so, you know, we have our theories that drive our work, human rights, social justice, feminist, you know, all of those pieces that drive like the crux of what many of our organizations do. And so this type of evaluation really helps you to take your values, right? You all have mission statements and value statements, right? And if you're a mission-driven organization, you're reminded of them often, right? It's part of our onboarding process and orientation process when we bring new people in. For us, it's a community capacity approach. You heard us start with that at the beginning of this webinar. We start with that at every single presentation, webinar that we give to ground people in like our theory of change and where we think the work needs to happen in order for change to happen, to change systems. And ours is embedded in communities, right? And so for us, we can use that theory and develop principles, our mission, our values, develop principles, and then a principle-based evaluation allows us to follow that through. How do we evaluate then? How do we evaluate that we're upholding our principles as an organization, that our programs are developing environments that are mission-driven and values-based, and that our outcomes that we're tracking map on to what we think that the impact that we think we're having. So it helps provide direction. It's not prescriptive. We like this evaluation approach because it offers opportunities and expects that people are adapting what they're doing to different contexts, changing understanding and challenges like we mentioned before. It can be evaluated for both process and for results, right? So like I said, you can evaluate how you're doing and then the impact of what you're doing. And the principles are the object of the evaluation. So it's a very thought-provoking process. And it really makes you really map on the work that you're doing and how the match is, right, with what the organization says and they're doing and how they're intending to make an impact. Next slide, please, Rebecca. So what we did with our partners when we developed this section of the toolkit is we went through a process of developing principles. And these were principles specifically to organizations that work in the Latino community. And as you saw in one of the previous slides, our partners were very diverse in their approaches. They were diverse in the different intersections of Latino community members that they serve. And we did that purposely, right? Because we want to bring engaged stakeholders that have different perspectives and are working in Latino DV from different intersections. And so what we came to were these 6 core principles, like all the organizations were like, have different missions, have different, you know, ways that they're doing the work on the ground. But when we really try to tease out, like, what's the essence of the work that you're doing, these principles came out. And, you know, making sure that if you're working effectively, specifically with Latino communities, and these can be adapted. Thinking of for your community, right, what might that look like, and how might this language change? For our communities in the ones that we were thinking of in this work, the partner said, you know, you need to have a really deep understanding of the community that you serve, right? That's key. How are you tailoring your activities to really reflect the realities of your participants, to meet the needs of the whole person, not just the trauma per se, right? But this person embedded in a larger context, embedded in a historical context, right? This person as a whole. Not only working at the individual level, but at the collective level. So what are your organizations doing to collectively heal communities and moving past the individual focused services? Creating alternative spaces, building on cultural strengths, collaboration, and minimizing hierarchical structures to really prioritize safety and trust between the program and participants. So these were the principles that they came up with to help guide their work our work together, from going from these principles. And this, it sounds easy, but as you all know, anyone who's done logic models or theory of change work, it takes years sometimes. So this, like, is pretty on one slide, but it took us over, I think, 1.5 years to really nail down, you know, what is the essence that we think are principles that other organizations serving Latino communities should also adapt and should be upholding to, right? This is, if someone wants to say we're culturally specific, then these are the principles that we think you should be abiding by, right? To be able to say that. And then what are you doing to evaluate these elements and improving your program? Rebecca, do you want to say anything? Are we ready for the next slide? You're muted again. Oh, you're muted, Rebecca.
I'm sorry, I'm bad at this, unmuting. I'm here. So I just wanted to share some of the worksheets that we've developed that are on the Building Evidence Toolkit website. They're available in English and Spanish. They're free for you to use and download as many, you know, copies as you'd like. So I think that the strength of many community-based organizations and programs, like the ones that we collaborated with, the ones that are represented here today, often include the ability to meet the needs of communities, various facets of communities, right, defined by different things of ethnicity, gender, other aspects of diversity. So I think that value-based, principles-based evaluation really helps us to do that. So we have these 3 worksheets. So when I'm working with an organization, and since we're the National Resource Center for Domestic Violence in Latino communities, I work with a lot of Latino serving domestic violence organizations and providing technical assistance around evaluation, planning, and troubleshooting, and things like that. So one of the things that we do when we're developing an evaluation plan is I show them the website, right, and we go through these different worksheets. And I added them to, you have them as a handout, I think. So the first worksheet is all about kind of reflecting on which core principles are important to you in your organization. There are 6 principles. There are multiple facets under each principle. So it's not usually easy to evaluate every single one, just because of time constraints and resources and things. Then we have them, you know, after considering these things, rank which ones they're going to kind of focus on, and then use those principles and follow it through to an evaluation plan. So we end up going from the principle to how we actually would assess this and measure impact or outcome. So I'll just show you the worksheets real quick, and this is super tiny, so hopefully you can follow along in your handout. But we wanted to start our worksheets with this reflection exercise. So we provide a series of prompts under each principle that really helps people think through the different components of their community. So I'll just go through an example. So the first principle, so in order to effectively work with Latino communities, community-based organizations must aim for a deep understanding of the community that they serve. So there are different sub-principles under here. The first being organizations represent that Latinas have different experiences, different worldviews, and then understanding the intersectional identities of your participants, and then thinking through also how do your participants define family, what does their family look like, because that can look very different for many different groups. So we just have the organization kind of just reflect on this, and it will take some time and some deep thinking for a little bit, but it really helps them kind of ground their experiences and help to the next step where they're considering which core principle do we want to evaluate. So this is the ranking worksheet. So we list all the different principles and their subcomponents, and then they'll kind of find their top 3, and then that's what we use to guide them through the evaluation plan, the principles-based evaluation. So the other worksheet that you have, building your evaluation plan. So after they've listed their top 3 core components, we'll go through and we'll figure out, what's the question that you want to know based on that principle? How do you know that things are changing, right? What are these indicators of change? And then also, where are the data sources coming from that can help you answer that question? So we'll go back and think through, we have community evidence, we have practitioner evidence, we have documented evidence, and they can start to kind of brainstorm, well, I think that this might come from our exit interview that we do, or it'll come from our case management forms. So kind of helping them think through that. So then the next is just figuring out if they are, if they're not currently collecting anything about that specific principle, then we may want to strategize on what are different ways that we could collect that information, right? And then having some kind of idea of when we would like to implement that is the kind of the last section there. So, and then there's another section. I mean, there's a lot of resources in this toolkit, so I've just kind of scratched the surface. We've just kind of scratched the surface today. But you'll also find additional resources on the website. There are, we try to archive or collect different resources that have been designed for domestic and sexual violence organizations, specifically around evaluation, how to develop logic models, theories of change, how to identify culturally specific evaluators. So if it's important to find somebody who has experience working with your particular community or an underrepresented group, and then some other resources. So there's a lot there, and I know that we've thrown a lot out there. So I wanted to save a little bit of time at the end for some questions. But first, I wonder, Josie, if you have anything to add.
No, I think that all of these tools were developed so that a practitioner in their office could step through them. So you'll see on our website, on the toolkit, it's really like, click here, answer this question, next, answer that question. So they're very user-friendly. But yes, we have some questions about, like, do we offer technical assistance for organizations? And we definitely do. You can decide to what extent you want that support to be, right? Either, just check in with someone I'm trying to implement this in my organization. Can I just check in and, with someone and just share ideas and thoughts, right? To, we have, we're looking for an evaluator, and we would like to work with an evaluator who is culturally specific and who understands this community, and, would you be willing to contract and come in that way, right? So we have like a range of ways that we provide assistance to folks, but that is available.
Mm-hmm. Yeah, thanks, Josie. I would also add that there is a section on here that kind of summarizes what to look out for when you're hiring an evaluator, right? It's kind of summarizing the different red flags that you might see where you may not want to hire that person as your evaluator, kind of when you're going for a more culturally specific approach or principles-based evaluation as well.
Yeah, that's definitely really important. As any field, evaluators are trained with this, certain perspectives and certain methodologies and certain, theories. And we've been lucky. Rebecca and I came from the same department and the same mentor, who was a culturally relevant researcher and community-based researcher. So we have been lucky enough to have that experience and really have that lens in the work that we do, and on the, every day with organizations. And so I think it is really important for you as an organization to be able to look at the match between your organization's values, right, and principles, and does an evaluator get that? How do you ask them questions, right? Asking them for their CV, asking them for their experience of working in your community, asking them to volunteer in your community before they can come in and do research and evaluation, right? Having them go through your volunteer training, right? All of those things are things that you should be comfortable with expecting from an evaluator and researcher. Research for an evaluation in communities of color and marginalized community is very sensitive, and you should expect evaluators and researchers that you partner with to understand the context, and if they don't have the experience, to be able to lay out for you in partnership with you their plans, right, to really get to know your community. And so that, I think that resource there could be really helpful for folks. I think oftentimes researchers and evaluators come in and paint it as if it's a win-win situation, or, like, we have something amazing we're going to offer you, but really don't leave tools with you, aren't really including you from the beginning, so you're not building your capacity. So our goal is that you build your capacity so you don't need research and evaluators to come in and do this for you, but that you have the tools and that you can start to do your own evaluations moving forward, right? So those are really important things, I think, to think about as an organization when you're partnering with research and evaluators.
Mm-hmm. Absolutely. Thank you, Josie. So we have a few minutes left, and we have saved some time for question and answers, if that can be done in the chat box.
Awesome. Yeah, thank you so much, both of you. And so if anybody else has any other questions, I know that some of them have been asked throughout the presentation, but if you have any other additional questions, please put them in the group chat and send them to everyone, and then we'll be able to address them that way. What I'm also going to be doing right now is putting up a survey for folks to answer about their experience of this webinar as well. So you'll be able to see that popping up on your screen if you're joining us through a browser. And so if you all aren't able to as well, I will be sending this out after the webinar as well, so that folks can fill it out remotely from their own computer.
Mm-hmm.
And so while folks are doing that, I just wanted to say thank you so much for this experience and talking about your experiences as folks who've been doing culturally specific evaluations. I really hadn't thought about what it would be like to ask an evaluator to go through a volunteer training or something like that. And, I think that often, like you're saying, a lot of evaluators have been trained from a certain lens and don't necessarily understand what it's like to work with communities of color and work with other marginalized communities. So that's great. That's a great pointer to think about. Thank you.
Yeah, I think it's important if, you know, we have a couple of layers, right? We have the cultural specific aspects of our communities, so that's one. But then we have the domestic violence, sexual assault, right? So you really want evaluators and researchers who have a solid understanding in trauma-informed practice. And a lot of our work, quite a bit, Rebecca, would you say, we're talking to researchers and other evaluators and just building the capacity on like, how to ask certain questions, what to ask, what not to ask, you know, like it's not okay just to take you know, measures from the shelf and implement them without considering like who's on the other end of that survey, and that you're working with folks who have gone through trauma, right? And may not want to fill out your 10-page survey because that's like the last thing that they're thinking about doing. You know, like they want to focus on what they want to focus on. And that's okay, right? And so some of my work has been working with organizations to like, let's take this back a notch. Like, do you really need to ask these like detailed historical questions from someone who's in a crisis right now, right? Like, no, the answer is no. The answer is no, you don't. And what's the purpose of your evaluation? And what's the purpose of you collecting this data, right? And so it's like those ethical pieces to evaluation as well that that you want your researchers and evaluators to understand. So if they don't have that experience, having them volunteer in your organization, having them go to the training, having them gain that experience is an expectation that should be important for you guys.
Yeah, that's great. Thank you so much. So I think we've left ample time for folks to be able to fill out any questions inside of the group chat. I know on the next slide you also had some contact info if folks had further questions. Yeah, so if you all want to just go over that really quickly.
Yeah, so you can see, so we have Casa de Esperanza has its own kind of web page. You can navigate to either one from one or the other, but the Casa de Esperanza web page that talks about kind of the local stuff that's happening in St. Paul, and then the National Latino Network, we have the policy, research, and TA, training and technical assistance, information held there, and our emails, and I guess that would be the best way to reach out. If you'd like, I'd be happy to talk more with any of you about, you know, this evaluation, moving it forward.
Yeah, thank you so much.
And then we'll send out the link to the toolkit. You guys have the handout and then the article that we mentioned. Oh, and then here's the book that we were talking about, Principles Focused Evaluation. So we'll send that citation as well, just in case you're wanting to utilize that approach to you all.
Yeah, thank you so much. I'll definitely, once I get those links from you, I'll be able to put it out to everybody who attended this webinar, and also let folks know that you all are a resource to be able to reach out to. Thank you for sharing your knowledge. I really enjoyed learning from you all, and I'm excited that this will open up some possibilities for our membership to continue thinking about what evaluation means to them for their communities. So thank you.
Thanks for having us.
Thanks. Bye.
Bye-bye.
Bye. Take care.
Thanks.